The U.S. is seeing an outbreak of new coronavirus cases in areas where vaccination rates remain low. Infections are being driven by the highly contagious Delta variant, which is now the dominant strain here in the U.S. It accounts for 83% of new cases. Data from the CDC shows 48% of Americans have now been fully vaccinated and 56% have received at least one dose. CBS's Michael George has the latest details.
We've got to get folks to take the shot. The vaccine is the greatest weapon we have to fight COVID. There's no question about that.
Only 39% of Alabamans are vaccinated. 60% are not.
What is it going to take to get people to get shots in ours?
I don't know. You tell me. Folks supposed to have common sense. But it's time to start blaming the unvaccinated folks, not the regular folks. It's the unvaccinated folks that are letting us down.
Less than half of the population in 16 states have received at least one dose of a COVID vaccine, bringing more patients to hospitals in need of critical care.
None of us believe that we would be in the situation that we were in now if we would have more of our population vaccinated.
Dr. Frank Cormier is medical director at Our Lady of Lourdes Hospital in Louisiana. It's a top COVID hotspot state, along with Nevada, Florida, Arkansas, and Missouri.
We're starting to experience enough patients where it concerns us once again that we're utilizing a major part of our resources are being shifted to being able to help and accommodate the influx of patients.
A concern echoed in San Antonio, where Chief Charles Hood runs emergency services.
Our citizens are still going to be in accidents. They're still going to be injured. They're still going to have heart attacks. That causes us to potentially divert to other locations, and maybe they don't get the standard of care as quick as they could.
For more on this, I want to bring in Dr. William Schaffner. He's a professor of infectious diseases at Vanderbilt University Medical Center in Nashville, Tennessee. Dr. Schaffner, thanks for being here. In Tennessee, only 43% of people have received at least one dose of the vaccine. What do you say to those who are still hesitant to get the shot?
Well, Lana, it breaks my heart that only 43% of folks here in Tennessee have received the vaccine. We have to ask each and every person what their issues are, respect that, and then try to provide the good information. And in addition, try to make them feel comfortable and reassured that doing this is really good for them, their family, and their entire communities. We're down to doing this one person at a time. The era of large vaccination clinics where people drive through, we're past that, done that. Now it's one at a time.
Well, with the Delta variant accounting for a majority of new cases and given its increased infectiousness, how worried should those who are vaccinated be about breakthrough infections now?
Well, the vast majority of infections are occurring among unvaccinated people. Of course, they produce a lot of virus, and they put everyone at some risk. Now, fortunately, the vaccines protect against Delta. They will keep us out of the hospital. But it is true, you can get a minor infection, a mild one that has either no symptoms or the symptoms of a cold. That will occur more frequently if there are lots of unvaccinated people in your community still spreading the virus about.
Well, we just heard the Republican governor of Alabama blame those who are unvaccinated for the spike in COVID cases. She was making the case that getting vaccinated is a personal responsibility, a tenet of conservative beliefs. Given how political affiliation has been associated with vaccination rates, is it helpful when Republican leaders come out, in this case, forcefully in favor of vaccinations?
Well, we would like as many leaders who are trusted, whether they're political, religious, business, whatever, friends in your community, to actually come out in favor and advocate for vaccination. Blaming doesn't help. Let's put the emphasis on the positive side about all the good that these vaccines can do and that we're all doing this together. I think that is much more likely to persuade people to be vaccinated.
Can you understand, as a medical practitioner, the governor's frustration in that statement?
We're all frustrated, aren't we? Because so many people seem not to have gotten the message yet what a good thing this is and how safe the vaccines are. We can't let frustration get in the way of our trying to do the best for our entire community. I don't want anyone to be sick.
Understood. St. Louis, Missouri will reinstate a mask mandate on Monday. Masks will be required in public indoor places and public transportation for people age 5 and older, even if they are vaccinated. Do you think more cities and states should be reconsidering mask mandates and social distancing requirements as Delta spreads?
Well, Lana, it's happening, isn't it? Started in Los Angeles County, now we have St. Louis, and there are other communities around the country where transmission continues at sufficient intensity that the local public health authorities are now reinstituting masking for everyone in enclosed spaces. That's a reasonable thing to do. Those decisions will be made at a local level.
Well, the CDC says that variants of the virus account for all cases now here in the U.S. and that the original strain is no longer even detected. Explain once more how preventative measures like the vaccine work to slow the emergence of new, more powerful variants.
Vaccines prevent infection. The virus, when it infects somebody, multiplies billions of times and can mutate. And on occasion, one of these mutations, or maybe a series of them together, can create a variant that has different characteristics than the parent strain. This Delta, for example, can run faster. It's easier to be transmitted. That's a distinctive characteristic. So if you're unvaccinated and you become infected, there's the possibility that your infection could result in one of these variants. That's just one of many reasons we ask people to be vaccinated.
Yet another reason to roll up those sleeves. Dr. William Schaffner, thank you so much for coming on and explaining this to us, and thank you for all that you do.
Thank you.